What if I told you that one tiny letter, just A, B, or O, could reveal which disease your body is naturally more vulnerable to long before the first symptom ever appears? Most people spend years worrying about their cholesterol, their blood pressure, or the number on the bathroom scale. Others invest thousands of dollars in genetic tests, hoping to uncover hidden health risks. But very few people ever stop to ask one surprisingly simple question: what is my blood type actually telling me? The answer may surprise you, because your blood type isn't just important when you need a transfusion. According to growing scientific evidence, it may influence how your body responds to inflammation, blood clotting, metabolism, certain infections, and even the way your brain ages. That doesn't mean your blood type decides your future, but it may quietly determine where your body is naturally more vulnerable, and knowing that could help you protect yourself years before a serious illness develops. Let me tell you about someone I'll never forget. A few months ago, I met a patient I'll call Michael. Michael was only 41 years old. He exercised almost every day. He completed half marathons for fun. He had never smoked, rarely drank alcohol, and his annual physical exams always came back looking excellent. His cholesterol levels were well controlled. His blood pressure was normal. His blood sugar was exactly where it should be. By almost every traditional measurement, he looked like someone with decades of healthy life ahead of him. Yet there he was, sitting across from me only days after surviving a massive heart attack. He still had a small bandage covering the artery where doctors had performed an emergency procedure to restore blood flow to his heart. As we reviewed his medical history, nothing seemed to explain why this had happened. Then I asked a question that no one else had asked him. "What blood type are you?" He answered without hesitation. "Type A." Then he added something that immediately caught my attention. My father was also type A. His father had suffered a fatal heart attack before the age of 50. At that moment, Michael realized something he had never connected before. For years, every doctor had discussed his cholesterol. Every doctor had talked about his blood pressure. Every doctor had reminded him to exercise. Not one had ever explained how his blood type could fit into the larger picture of his health. Now, to be absolutely clear, having the same blood type as a parent does not mean the same disease is guaranteed to happen to you. That is not how medicine works. But blood type can be one important piece of a much larger puzzle, one that many people never even realize exists. And that's exactly why we're having this conversation today. Over the next few minutes, I'm going to walk you through what modern research has discovered about each of the four major blood types. You'll learn why one blood type appears to have a higher tendency toward abnormal clotting, why another may face greater challenges with blood sugar regulation, why one group may be more vulnerable to stomach problems, and why researchers have become increasingly interested in one particular blood type when studying memory decline later in life. Most importantly, I'll show you what you can actually do about it, because understanding your biology is never about creating fear. It's about giving yourself more opportunities to stay healthy. Before we dive in, I'd love to know where you're watching from and what your blood type is if you already know it. Share it in the comments below. It's always fascinating to see people from all over the world joining these conversations. Now let's answer the question almost nobody asks. Why does a single letter have anything to do with your long-term health? The answer begins much deeper inside your body than most people realize. Most of us first learn about blood types in school. Type A, type B, type AB, type O. And we're usually told exactly one thing: they matter when someone needs a blood transfusion. After that, we rarely think about them again. For many people, blood type becomes nothing more than a small note inside a medical record. But here's what most people never hear. Your blood type is not simply floating inside your bloodstream. The same biological markers that determine your blood type are found throughout your body. They are present on the surface of blood vessels, inside parts of your digestive system, on cells involved in metabolism, and even in tissues connected to your immune system. In other words, your blood type is not just a label attached to your blood. It's part of the way your body is built. Think of it like the blueprint used to construct a house. Two homes may look similar from the outside, but if their foundations are built differently, they'll respond differently to earthquakes, storms, and years of wear. Our bodies work in much the same way. People can eat similar foods, have similar lifestyles, and even share similar cholesterol levels, yet their bodies may react very differently to the same environmental stress. One person develops diabetes, another develops heart disease, someone else struggles with chronic stomach inflammation. Why? Lifestyle certainly plays a major role, but biology also shapes where those risks are most likely to appear. Interestingly, the story of blood types began thousands of years before modern medicine ever existed. Long before hospitals, long before antibiotics, long before vaccines, human beings faced entirely different threats: deadly infections, famine, harsh climates, and diseases that spread rapidly through entire populations. Over countless generations, different blood types became more common in different regions of the world because each offered certain survival advantages under specific conditions. Some may have provided stronger protection against particular infectious diseases. Others may have helped the immune system respond differently to unfamiliar environments. No blood type was designed to be better. If one had truly been superior in every situation, it would likely have become the only blood type left today. Instead, all four remained because each offered advantages under different circumstances. But here's where things become fascinating. The world changed dramatically. Our biology didn't. The bodies that once evolved to survive ancient infections now face processed food, chronic stress, poor sleep, air pollution, physical inactivity, and excess sugar. The environment transformed in just a few generations. Evolution simply hasn't had enough time to catch up. And that's where modern research begins to notice patterns. Scientists studying large populations have found that certain blood types appear more likely to develop particular health conditions than others. Notice the word appear. These studies describe statistical tendencies, not guarantees. Your blood type is never your destiny. It is one factor among many. Age matters, exercise matters, nutrition matters, sleep matters, smoking matters, blood pressure matters, blood sugar matters. All of these factors interact with your underlying biology. So, if blood type isn't destiny, how could it possibly influence disease risk? The answer lies in a remarkable system inside your bloodstream that is working every second of every day without you even noticing. It's a system designed to save your life whenever you're injured. Ironically, under the wrong conditions, that same protective system can sometimes become part of the problem. And once you understand how it works, everything we're about to discuss about each blood type will make far more sense. Now that you understand your blood type is much more than a label, the next question becomes obvious. How could one simple letter possibly influence something as serious as a heart attack, a stroke, or even memory loss? To answer that, we need to look at one of the most remarkable defense systems inside your body. Imagine you're driving across a bridge when suddenly a small crack appears in the road. Within minutes, emergency workers arrive. Construction crews place barriers around the damaged area. They build a temporary structure to keep traffic moving while repairs are made. Once everything is fixed, another team arrives to remove the temporary material so traffic can flow normally again. Your bloodstream works in a surprisingly similar way. Every second of every day, your blood vessels experience tiny amounts of wear and tear. Most of these microscopic injuries happen without you ever feeling them. When that happens, your body immediately activates its repair team. Special proteins and platelets rush to the damaged area, creating a temporary seal that prevents bleeding and protects the blood vessel while healing begins. This response is absolutely essential for survival. Without it, even a minor injury could become life-threatening. But here's where the story becomes more interesting. Building the repair is only half the job. Once the damage is healed, your body also needs a cleanup crew. Its job is to remove unnecessary clotting material so blood can continue flowing freely through your arteries. When both systems stay in perfect balance, everything works beautifully. Your blood repairs itself when necessary and then returns to normal. The problem begins when that balance shifts. Research has shown that people with non-O blood types often have naturally higher levels of certain clotting proteins, including von Willebrand factor and factor VIII. Think of it this way. Some people naturally have a larger construction crew. Their bodies respond quickly and efficiently whenever repairs are needed. That can be beneficial in certain situations. But if the cleanup crew can't keep pace, small repair sites may linger longer than they should. Over many years, especially when combined with high blood pressure, elevated blood sugar, smoking, obesity, or chronic inflammation, those lingering repair processes can gradually contribute to the formation of unwanted blood clots. It's important to understand that blood type alone doesn't create disease. Instead, it influences how your body reacts when other risk factors are present. Picture two people stuck in the same traffic jam. They breathe the same polluted air. They eat similar diets. They both have stressful jobs. One person's arteries recover quickly. The others remain inflamed just a little longer each time. That tiny difference, repeated thousands of times over decades, may eventually influence who develops cardiovascular disease first. Blood sugar makes this process even more complicated. When glucose remains elevated for long periods, it doesn't simply increase the risk of diabetes. It also damages the delicate lining of blood vessels, creating more opportunities for those repair systems to activate. Inflammation adds another layer. Poor sleep, chronic stress, smoking, excess body fat, and sedentary lifestyles all increase inflammation throughout the body. It's like sending construction crews out day after day because the roads never stop getting damaged. Eventually, constant repairs create their own problems. This is why doctors rarely point to a single cause when someone develops heart disease. It's almost never one thing. It's the combination of genetics, environment, aging, and daily habits working together over many years. Your blood type simply influences one piece of that equation. So what does that actually mean for you? Does every blood type face the same challenges? Not at all. Each one seems to have its own unique strengths and its own unique vulnerabilities, and some of those differences are far more surprising than most people realize. Let's start with the blood type that many researchers consider the most naturally protected when it comes to clotting. It isn't perfect. In fact, it has a completely different weakness that millions of people overlook every single day. Let's begin with type O. Worldwide, it's the most common blood type, and from a cardiovascular perspective, it often receives the most attention. People with type O generally have lower levels of several clotting proteins compared to non-O blood types. As a result, many studies have observed a slightly lower tendency toward abnormal blood clot formation. That doesn't make type O immune to heart attacks or strokes. Far from it. A sedentary lifestyle, uncontrolled blood pressure, smoking, diabetes, and high cholesterol can still dramatically increase cardiovascular risk, regardless of blood type. But when researchers compare large populations, type O often appears to have a small advantage in this particular area. However, nature rarely gives advantages without trade-offs. The same biological characteristics that may reduce excessive clotting also seem to create greater vulnerability elsewhere. One of the best-known examples involves a bacterium called Helicobacter pylori. This microorganism has infected humans for thousands of years and is remarkably common around the world. Many people carry it without knowing. For some individuals, it causes very few symptoms. For others, it contributes to chronic gastritis, stomach ulcers, and long-term inflammation inside the digestive tract. Several studies suggest that people with type O may be more susceptible to certain complications related to H. pylori infection. That doesn't mean every person with type O will develop ulcers. It simply means stomach health deserves special attention. Persistent heartburn, frequent indigestion, burning pain after meals, ongoing stomach discomfort that never completely goes away. These are symptoms that should never be ignored, regardless of blood type. Your stomach often whispers before it starts screaming. Now let's move to type A. This blood type tells a very different story. As we discussed earlier, people with type A generally have higher levels of clotting-related proteins than those with type O. Over an entire lifetime, this may contribute to a slightly greater tendency toward blood clot formation under the right conditions. Again, the key word is may. Blood type increases probability. It does not predict certainty. Think about two neighbors. Both are 55 years old. Both have similar cholesterol levels. Both work office jobs. One walks every evening, sleeps 7 to 8 hours, keeps blood pressure under control, and never smokes. The other sits most of the day, struggles with obesity, smokes a pack of cigarettes every day, and rarely exercises. Even if both share the same blood type, their futures may look completely different. Lifestyle always has the power to amplify or dramatically reduce genetic risk. Researchers have also observed that people with type A may have a somewhat higher risk of certain stomach cancers compared with some other blood groups, particularly when chronic inflammation caused by Helicobacter pylori remains untreated for many years. This is another reminder that health risks rarely happen overnight. Disease is often the result of decades of small changes accumulating quietly beneath the surface. If you have type A, One of the most important decisions you can make is to eliminate anything that places additional stress on your blood vessels. Smoking deserves special attention. Cigarette smoke damages the inner lining of arteries, increases inflammation, and promotes clot formation. When those effects combine with an already elevated tendency toward clotting, the result can become significantly more dangerous over time. The encouraging news is that every cigarette not smoked, every healthy meal, every walk around the neighborhood, every good night's sleep, and every improvement in blood pressure helps move the odds back in your favor. But we're only halfway through the story. The next two blood types present an entirely different set of challenges. One appears to be more closely connected with blood sugar regulation and metabolic health. The other has become the focus of growing research into cognitive decline and memory loss later in life. And what scientists have discovered about that final blood type may surprise you. Now let's turn our attention to the remaining two blood types. While type O and type A are often discussed because of their relationship with cardiovascular health, type B and type AB tell a very different story. Let's begin with type B. If you have type B blood, the conversation shifts away from your arteries for a moment and focuses on something just as important, your metabolism. One of the strongest patterns researchers have observed is a possible association between type B and a higher likelihood of developing insulin resistance and type 2 diabetes compared with certain other blood groups. Again, this isn't a prediction. Millions of people with type B will never develop diabetes, and plenty of people with other blood types certainly will. But understanding where your body may be more vulnerable allows you to pay attention before problems develop instead of after. Think about what happens when blood sugar stays elevated for years. At first, nothing feels different. You still have energy. You still go to work. You still enjoy life. Then little changes begin appearing. You gain weight around your waist even though your eating habits haven't changed much. Your energy crashes in the afternoon. You wake up feeling tired instead of refreshed. Your annual blood work starts showing fasting glucose that's just a little higher than last year. Nothing dramatic. Just enough to ignore. But beneath the surface, your metabolism is slowly becoming less efficient. Your cells no longer respond to insulin the way they once did. Your body compensates by producing more insulin. Eventually, blood sugar begins creeping higher and higher. At the same time, elevated glucose places additional stress on your blood vessels, increases inflammation, and makes cardiovascular disease more likely later on. That's why diabetes is never just about sugar. It affects nearly every organ system in the body: your eyes, your kidneys, your nerves, your heart, even your brain. Whenever I speak with patients who have type B blood, I encourage them to think of metabolic health as their early warning system. Don't wait until diabetes appears. Pay attention to your waist circumference. Pay attention to how active you are. Pay attention to how often highly processed foods become the center of your meals. Those small daily choices often matter far more than people realize. Now let's move to the rarest blood type of the four. Type AB. Only a small percentage of the population has it. For years, researchers paid relatively little attention to this blood group simply because there were fewer people available to study. But as larger studies followed tens of thousands of participants over many years, an interesting pattern began to emerge. Several researchers noticed that individuals with type AB appeared to experience a higher incidence of cognitive decline and dementia later in life compared with some other blood groups. Naturally, that raises an important question. Why would a blood type have anything to do with memory? Scientists don't believe there's one simple explanation. Instead, they think several biological processes may be working together. Remember the repair system we discussed earlier? The one responsible for controlling bleeding and forming blood clots? Researchers suspect that subtle differences in clotting activity may influence the health of the tiny blood vessels that nourish the brain. Unlike a major stroke, these microscopic changes don't usually cause dramatic symptoms overnight. Instead, they may slowly reduce blood flow to delicate brain tissue over many years. Imagine watering a beautiful garden. If one large pipe suddenly breaks, you'll notice immediately. But if hundreds of tiny irrigation tubes gradually deliver a little less water every season, the plants don't die overnight. They slowly become weaker. The brain may respond in a similar way. Memory isn't something we lose all at once. It's often the result of countless biological events accumulating over decades. This is exactly why neurologists emphasize protecting brain health long before memory problems appear. Regular movement. healthy blood pressure, stable blood sugar, quality sleep, social interaction, continuous learning. These habits support the brain regardless of blood type, but they may become especially important for individuals whose biology already places greater stress on the vascular system. Here's what I don't want anyone watching this video to do. I don't want someone with type AB thinking, well, I guess memory loss is inevitable, because that's simply not supported by the evidence. Blood type is a risk factor. It is not a life sentence. And that brings us to perhaps the most important message in this entire video. Because once people hear words like genetics or inherited risk, many immediately assume their future has already been decided. Nothing could be further from the truth. Whenever people hear the word genetics, they often imagine something permanent, something impossible to change. I understand why. After all, you can't wake up tomorrow morning and decide to have a different blood type. That part of you has been there since birth. But here's what many people misunderstand. Genetics influence probability. They do not eliminate choice. I often tell my patients to think of genetics as the weather forecast. If tomorrow's forecast predicts rain, that doesn't mean you're guaranteed to get soaked. You can bring an umbrella, wear a raincoat, or stay indoors. The forecast changes your preparation, not your destiny. Your blood type works much the same way. It tells you where your body may need a little more attention. Nothing more, nothing less. I've treated patients with multiple genetic risk factors who reached their 80s and 90s with remarkable health because they consistently made good decisions over many years. I've also treated people with very few inherited risks who developed serious disease decades earlier because unhealthy habits slowly accumulated until the body simply couldn't compensate anymore. That's why focusing only on genetics misses the bigger picture. Every healthy choice you make changes the environment your genes live in. When you exercise regularly, you're not simply burning calories. You're improving insulin sensitivity, supporting healthier blood vessels, reducing inflammation, helping your brain receive better blood flow. When you sleep well, your body repairs damaged tissues more efficiently. Hormones involved in appetite and metabolism function more normally. Stress hormones decline. Recovery improves. When you choose meals rich in vegetables, fruits, legumes, healthy fats, lean protein, and fiber, you're supplying your body with the nutrients it needs to maintain healthy cells while reducing many of the metabolic stresses associated with chronic disease. And when you stop smoking, something remarkable begins to happen. Within weeks, your circulation starts improving. Over time, inflammation decreases. Your blood vessels become healthier. Your cardiovascular risk begins moving in the right direction. The body has an extraordinary ability to recover when we stop placing obstacles in its path. People often ask me, Dr. Carter, if I already have a family history of heart disease or diabetes, is it too late? My answer is almost always the same. The best time to begin was years ago. The second best time is today. No one can change yesterday's decisions, but every decision you make after watching this video has the potential to influence the years ahead. The goal isn't perfection, it's consistency. One healthy meal won't transform your future. Neither will one workout or one good night's sleep. But thousands of small decisions, repeated over months and years, create outcomes that can be dramatically different from where you started. Now that we've discussed how blood type may influence risk and why lifestyle remains the most powerful tool you have, let's finish with something practical. If you walked away from this video remembering only 4 actions, which ones would have the greatest impact on protecting your long-term health? Those 4 steps are exactly what we're going to cover next. We've covered a lot of information today. We've talked about how different blood types may influence clotting, metabolism, stomach health, and even the way the brain ages. But if you remember only one thing from this entire conversation, let it be this. Your blood type is information, not a prediction. It gives you a map. What you choose to do with that map is entirely up to you. So let's finish with 4 practical habits that can help protect your health regardless of which blood type you have. The first is simple. Move your body consistently. You don't have to become a marathon runner. You don't have to spend 2 hours in the gym every day. In fact, some of the greatest health benefits come from activities that almost anyone can do. A brisk walk, cycling, swimming, dancing, gardening. Anything that keeps your body moving on a regular basis. Current health guidelines recommend at least 150 minutes of moderate physical activity each week. That's only about 30 minutes a day, 5 days a week. Regular movement helps improve circulation, supports healthy blood vessels, increases insulin sensitivity, lowers inflammation, and benefits nearly every organ in your body. If your blood type naturally leans toward a higher tendency for clotting or metabolic disease, exercise becomes even more valuable, not because it changes your blood type, but because it changes the environment your body lives in every single day. The second habit is to keep your blood sugar under control. Even if you've never been diagnosed with diabetes, consistently elevated blood sugar places stress on your arteries, your kidneys, your eyes, your nerves, and your brain. Many people think sugar is only a problem once diabetes develops. The truth is, metabolic health begins long before a diagnosis. Choosing whole foods more often than ultra-processed foods, eating enough fiber, maintaining a healthy body weight, and staying physically active all help your body regulate glucose more effectively. These aren't temporary diets, they're lifelong investments. The third habit is something many people never consider. Don't rely only on routine blood work. Traditional cholesterol tests are incredibly useful, but they don't tell the entire story. Depending on your personal medical history and family history, it may be worth discussing additional cardiovascular screening with your healthcare provider. For some people, that conversation may include tests such as a coronary artery calcium score, high-sensitivity C-reactive protein, or lipoprotein A, often called LPA. These tests aren't necessary for everyone. But for individuals with a strong family history of early heart disease or other significant risk factors, they may provide valuable information that standard testing can miss. This is why personalized medicine is becoming increasingly important. Two people can have identical cholesterol numbers while carrying very different levels of cardiovascular risk. Understanding your complete picture allows your healthcare team to make better decisions together with you. Finally, know your own weak spot, not because you should fear it, because you should respect it. If you're type O, don't ignore persistent stomach symptoms simply because you assume they're caused by stress or spicy food. If you're type A, pay close attention to cardiovascular health, avoid smoking, and work with your physician to manage blood pressure and other modifiable risks. If you're type B, treat metabolic health as a priority long before blood sugar becomes a problem. Protect your waistline. Stay active. Monitor your glucose as recommended. And if you're type AB, remember that supporting brain health begins decades before memory problems ever appear. Exercise regularly. Challenge your mind by learning new skills. Prioritize quality sleep. Stay socially connected. Control blood pressure. Protecting the brain isn't one decision. It's thousands of small decisions repeated throughout life. As we finish today's discussion, I'd like to leave you with one final thought. You didn't choose your blood type. None of us did. You didn't choose the genes you inherited from your parents. But every morning, you do get to choose how you care for the body those genes were given. You choose whether to take a walk or remain on the couch. You choose whether to schedule that overdue checkup. You choose whether to prepare a healthier meal or keep putting it off until tomorrow. Those choices, repeated over years, often have a far greater influence on your future than a single letter on a laboratory report. Knowing your blood type isn't about living in fear. It's about understanding your body well enough to make smarter decisions before problems arise. Because prevention is always easier than treatment. And the earlier you begin, the more opportunities you give yourself to stay healthy for years to come. Before you leave, there's one more important topic I don't want you to miss. Many people who suffer heart attacks have normal cholesterol levels. How is that possible? One answer may involve a little-known inherited particle called lipoprotein A, or LPA. It's a cardiovascular risk factor that often goes undetected because it isn't included in most routine blood tests. In fact, many people have never even heard of it until after a serious cardiac event. In my next video, I'll explain what LPA is, why it matters, who should be tested, and how it may influence your long-term heart health even when your cholesterol numbers appear perfectly normal. If you found today's discussion helpful, I hope you'll join me for that conversation. Thank you for spending this time with me. Take good care of yourself, stay curious about your health, and I'll see you in the next video.